this is our wall angel test. I've got Kristen with her feet 4 to 6 inches from the wall. We've got a 2x4 in the way today, so that's actually perfect. And I'm going to ask you to go ahead and put your spine against the wall, so leaning against the wall. When Kristen leans against the wall, most of our patients, they've got this little bit of space that's right here, completely normal. I'm just going to ask her to get rid of that space, okay? Now, when she gets rid of that space, I'm watching what she does, right? This should be able to stay on the wall while she gets rid of this space. So I'll just double check. Okay, doing good? All right. Kristen already knows the test, so she's already put her EOP against the wall, okay? And she's looking pretty good. We're still, cervical spine's in a really nice position. She does have a ponytail, but I'm gonna let her cheat today. Now, I'll tell you something. Go into anterior cervical head carriage. Good. If this was Kristen's actual neck, and I asked her to put her head against the wall, she probably doesn't know how to retract for me, so most patients are going to extend to get their head against the wall. That's going to increase this chin angle to greater than 90 degrees. You should be able to pick that up. If this is what happens for Kristen to get against the wall, I'm thinking tightness in the sternocleidomastoid muscle, possibly the suboccipitals, in addition to having that problem with that anterior head carriage. Good, go back to neutral. Okay. Go super slouchy here. Good. If Kristen is stuck in thoracic flexion, that pulls her head off the wall as well. She's having a problem here. Okay, stay there. It's super hard to do. If she's, again, stuck in thoracic flexion, and she goes to get her head against the wall, tilt back, that's another thing that you might see. So just because they go into this position, don't always go right to the head and blame the head. It could be a thoracic extension problem. So good, go back to neutral, your really nice posture that you have. Good, we're checking everything to make sure she's there. She's gonna abduct her shoulders to 90 degrees. I watch her while she gets into that position. I'm gonna double check, make sure she's staying here. Sometimes your patients are gonna start to suffer a little bit in this position. They're gonna talk about them being really tight. That's probably because they have terrible thoracic extension, okay? We're gonna take this step one step farther. We're gonna ask you to externally rotate both hands. Good, now, just ever so slightly, do you see like her watch is movable? She's using her fingers to get her hand against the wall, okay? There we go, she can flatten that out just a little bit more. If she cannot, come back towards me, flex here. If she cannot get into full external rotation, and this is what she looks like, we have tightness in the subscap, okay? Again, she should be able to get to glenohumeral extension to 90 degrees with no problem, and our spine is still against the wall. That's the wall angel test.